from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Well, we are back now with our sponsor, Baptist Health, and you hear the same message this time of year. Enjoy the outdoors, but make sure and protect your skin. It's easy to ignore a message we hear over and over, but today we have Baptist Health here to help keep our summer amazing. Dermatologist Dr. Matt Graham is here. Good to have you with Dermatology Group of Arkansas to talk about melanoma, and one of his patients, Richard Wood, is here to tell us about his experiences. Welcome to both of you. We do hear the message a lot, but this is so serious, right?
Definitely. Unfortunately, melanoma takes the life of about one person every hour in the United States.
Wow.
And is the sixth most common cause of cancer death in the United States. About 76,000 people are diagnosed with invasive melanoma a year. And unfortunately, unlike most cancers where the numbers are going down, melanoma is actually going up.
Is that because we were out in the sun so much as kids, or we're still out in the sun
It's
a lot?
probably a combination of that plus populations living longer.
Right.
A little bit of that, maybe increased diagnosis as well.
Okay, Richard, what sent you to Dr. Graham? What did you see, or what were you thinking about?
Well, actually, my wife had noticed a mole on my back. She actually took a picture of it with her phone and had been watching it. And one day I actually scratched it with a back scratcher. Irritated it. She didn't like that.
Not a good thing to do, probably,
not a good
right?
thing. Then my daughter Carissa just had started with Dr. Graham, and kind of they made a phone call, and the next day she told me, "Buddy, you got an appointment with Dr. Graham." So
Good.
I said, "Yes, ma'am." I'm
Good
going.
for those women in your family, right? To get you in there. Okay, and then you got your diagnosis of melanoma?
Yeah, actually, Dr. Graham, as soon as he looked at the mole, he told me that was a classic melanoma. And so we went from there.
Yeah, were you surprised to hear
Actually, I was, and I think, my wife Trish, the early detection and sending me to the doctor, it was a stage 2. And without her, probably it would be back here growing still. So.
Right, yeah. So let's talk about that, when he came to you and what you saw, and then you immediately knew it was something that needed to be taken seriously.
Unfortunately, it was one of those where you look at it, and I was fairly certain it was a melanoma, and you just biopsy it and wait for the results to come back. And the things we look for in a melanoma are kind of the ABCDs of melanoma.
Okay.
So asymmetry is A, is the asymmetric, one side's different than the other. B is the border, is the edges of it irregular. C is the color, so multiple colors, different shades of black and brown are concerning. D is the diameter, so if it's bigger than a pencil head eraser, that's a little red flag. And E means evolving, so you had a mole, it's been there for years, and all of a sudden it starts to change or itch or bleed or do something funny. And that's kind of what you look for to screen at home, and in general what we kind of look for when we look at, is this a regular mole or a bad mole, or what is this?
Early detection makes all the difference, right?
Most certainly. Melanoma is a cancer that if it is caught early, in situ or early stage, it basically has a 100% cure rate when you cut it out. If you catch it late and it's spread throughout your body, it's a very aggressive, difficult to treat cancer that, like I said, takes the lives of a lot of Americans.
Yeah. You look like you love the sun, like a lot of us do here in Arkansas.
Yeah,
have you changed your lifestyle a little bit?
For sure. I mean, I got a new respect for the sun. So every time I'm in the yard, of course, I have the big rim hat on now, and lotion, sunscreen.
Absolutely.
Sunscreen.
Yeah.
For sure.
It'll wake you up.
It'll
won't
scare
it?
you, for sure.
Well, what kind of treatments are there, and what will he continue to do kind of for the rest of his life now?
The treatments are really based on how early it was caught. For the most part, if it's caught early, you have an excision. Either a dermatologist will remove it, or a general surgeon or a cancer surgeon. And for the most part, the majority of people, that will treat their disease. If unfortunately it spreads and it's inside your lymph nodes or spreads throughout your body, then you're going to end up having to see an oncologist, like at CAR-T or UAMS, and they're going to have to do chemotherapy and things like that. And the treatments are really dependent on how far spread it is and where it is. And the treatment for melanoma is rapidly evolving. The cure rates are getting better and better and better, and we're getting more and more treatments that really improve the prognosis for patients with melanoma.
Should most of us as adults be going to a dermatologist and getting checked regularly?
In general, I would say yes. You know, if you have a lot of sun damage, you've been in a tanning bed, you've had burns when you were a child, or you have a lot of moles, you should go in to see a dermatologist and make sure to ask them to do a full skin examination where they put you in a gown and look at you from head to toe, because you can get melanoma in places where the sun doesn't shine. It's not very common, but it does happen. So get a thorough examination in general. If you've never had one, it's a good time to get one.
Sure.
And it only takes a few minutes because you can see it. It's right there. And if you need a biopsy, it only takes a few minutes. And, you know, some people have to have more frequent examinations than others, but if you've never had one, it's a good time to get one, or get one every few years just to kind of check on things.
Great advice, Richard. We are glad that your wife saw it and said you have an appointment, because you couldn't see it. She could. So we're thankful for that. Thank you for sharing your story, and thank you for talking about how we can all stay healthy in this Arkansas sun. We appreciate it. All right. Be sure and remember Baptist Health, and of course Arkansas Dermatology as well. They can set up an appointment if you need to, or set it up for someone in your family. 1-888-BAPTIST if you have any questions.